Thank you for joining us on Journey to 600. Today we're going to be diving into the neuromuscular section and focusing on synergy patterns. So what is a muscle synergy? A muscle synergy is defined as the coordinated recruitment of a group of muscles with a specific activation balances or specific activation waveforms. I took this quote directly from a source that I have linked in the description box below. To expand on this topic, synergistic movements refer to a coordinated movement that occurs when multiple muscles are activated simultaneously. So, like in a healthy individual, there are 4 specific muscle synergies used when walking. Each of these occur in different stages of a gait pattern, and it is essential for coordinating the movements required for walking. And I love a chart, a visual for me. I'm a visual learner. So in this chart, you could see on the top, I have upper extremity and the bottom is lower extremity. To the left is flexion synergies, and to the right is extension synergies. I created this chart myself because I found that my professors had some discrepancies. So I pulled my sources from the Big Red textbook, Physical Rehabilitation, and from what I understand, that is what is used to help make questions for the NPTE. So I find it really important that you also do your own research and not just rely on your professors to give you all the knowledge that you need. I'm not going to go over this chart because you could take a screenshot or write it out yourself or make a chart that makes more sense to you if this one doesn't. So, my next slide is a visual of the synergy patterns because I love a visual. So, you'll see in the upper extremity flexion synergy pattern that the shoulder is abducted and externally rotated, and that the elbow is flexed and forearm is supinated and the fingers are flexed. In this picture, it doesn't really show that the wrist can also be flexed, and you can't see scapular motion from these angles. Moving on to lower extremity flexion synergy pattern, you'll notice that the hip is flexed, abducted, and externally rotated, and that the knee is flexed and there's ankle dorsiflexion. And from this picture, you can't really tell that it's inverted and that the toes also can be dorsiflexed. Moving on to extension synergy patterns. With the upper body, you will have shoulder adduction and internal rotation, as well as elbow extension, forearm pronation, and the wrist and fingers can actually also be flexed in this one, according to the textbook. The picture does not show that though. And finally, we have lower extremity extension synergy pattern. In this picture, the hip is extended and adducted and internally rotated. The knee will be extended, the ankle will be plantar flexed, and you can't really tell once again, but the toes could be plantar flexed and the foot could be inverted. Now, I'm not saying these pictures are perfect, but I think it is a great visual to get the big motions. Those smaller motions are really hard to translate into pictures, I believe is the problem. Next, we have the 7 stages of recovery of spasticity. I'm not going to go into great detail because I actually already did a video based on the stages of recovery, and it is going to fly in right about now. So the difference between the original photo that I had up and mine that I created is I actually did include the 7th stage, which is when somebody has recovered normal movement and full control over their movement. And what I believe is more description over what you will actually see in each stage as far as like limb movement and what the limb can do. I will link this video in the description box below. I went over multiple different stages and levels. Okay, the correct answer is A. You're evaluating a patient who had a stroke, and you note that they are presenting with shoulder abduction and external rotation, as well as forearm supination. What synergy pattern is this? Well, looking at our answer choices, we could go ahead and eliminate C and D because this is upper extremity. We're looking at the shoulder. Now it's just a matter of flexion versus extension. With extension, you will find that the patient will have more of an adducted, so across the body, and internal rotation, as well as forearm pronation. Whereas with A, flexion, you will see that shoulder abduction and external rotation, as well as that forearm supination. Okay, the correct answer is B. Your patient is recovering from a recent stroke, and based on the 7 stages of recovery, you note that your patient is able to move within their synergy pattern. What stage is this? So let's go over each of them. A is stage 2. That is when a synergy pattern is developing. Stage 3 is when there's voluntary movement within the synergy pattern. Stage 4 is when spasticity decreases and someone can move outside of the synergy pattern. And stage 5 is an independent limb movement, further decreasing in that specific synergy pattern. So, if your patient is moving within their synergy pattern, that's how you get B, stage 3. Thank you for joining us on Journey to 600. Please like, subscribe, and turn on your notifications.